Hi, everyone, and welcome to the Thrive Co-Living Communities YouTube podcast. I'm Mark Stein, Thrive founder and your podcast host. We're creating sustainable, inclusive, and multi-generational residential communities from repurposed big box stores or other unused buildings. By offering unique and ecological co-living options, our aim is to combat the epidemic of isolation, revitalize communities, and help others discover the many benefits of engaged community living. In this podcast series, join us as we discuss co-living and other aspects of our concept, in addition to bringing you interesting people who are doing cool things from around the world. Through this podcast, learn more about our concept and see how Thrive co-living communities will bring together people from all walks of life. To find more about us, visit www.thrivecolivingcommunities.org. Thanks for watching and enjoy the podcast. Okay, welcome back, everyone, to the Thrive Co-Living Communities YouTube podcast. Glad to have you back, and I'm really happy to have Dr. April Wang with us today. She is an acupuncturist and a doctor of acupuncture, and she is from St. Petersburg, Florida, the area that I live in. And I met her because I'm a patient in her office. And she has helped me possibly we're third time with some issues that I'm having. And I'm so enthused about it that I wanted to share, because I know that most of you have some interest in acupuncture. So not only are we going to talk in general about it, but I've given up all of my HIPAA, privileges of secrecy, and we'll just, instead of speaking in general terms, we'll talk about what she's doing with me and what she's done to help me. So, Dr. Wang, thanks so much for being on the podcast. Welcome.
Thank you, Mark. I'm very happy to be here.
Great. So, first of all, you're from China, and
yes.
How long have you been in the U.S.?
I have been in the United States since 1998, so it's 24 years.
Wow. And you received your training in China, right?
Yes, I was MD in China, and we have to learn this Chinese medicine in medical school, in special medical school for 6 years. So after we graduated after 6 years in the school, we will be licensed in two medicine, Western medicine and the traditional Chinese medicine. So I have been working as an MD in a big hospital in Beijing for 10 years before I come to the United States.
I see. And you also work with herbs and nutritional therapies as well, in addition to the acupuncture, right?
Yes.
Here in the States.
Yes. When we talk about Chinese medicine, we include acupuncture and Chinese herbs, and also some other melodies like moxibustion, cupping, and also Tui Na is kind of Chinese massage. So when we talk about Chinese massage, we focus on the points as well and the channels.
And so your practice here in St. Pete is acupuncture and herbs,
yes.
Right?
Yes,
okay.
We do. Yeah.
So let me just tell the audience a little bit. I was moving last year about this time in January. We're in February of 2022 right now as we record this. So last January, I was moving and I lifted something inappropriately and strained my lower back. And I went to Dr. Wang, and in 3 visits within a week, she asked, as we started, to have an intensive 3 sessions right in the first week. And we'll talk about that in a moment. But I went from about an 8.5 out of 10 of pain down to about a 2 within that week. So I started having some problems with my neck. I had this is this year, had an MRI and had some bulging discs and some deterioration and some pinching of the spinal cord. So the spine doctor recommended up to 3 epidurals with cortisone and an anesthetic. And I said, no, I'm not a fan of cortisone. I feel like it just masks symptoms and keeps you from being aware of what the problem is. So I went back to Dr. Wang, and again, in 3 sessions within a week, I went from this was not as painful. It was about a 6.5, but it had been chronic. And now it's taken me back. I have some stiffness, but that's due to a pre-existing condition. So, but it took all the pain out of it within a week. So now she's treating me. I am telling the world about all of my maladies, but I have a prostate that is 20 times the size that it should be. And I said, why shouldn't we try it? So we've had 2 out of 3 visits on that, and I am seeing some improvement already. So I thought rather than be hypothetical in general, we could talk more specifically. So my first question is, when you're diagnosing, it seems like that this is an art and a science. And it seems like you're doing some intuitive work as well as thinking about the literal symptoms. Can you talk a little bit about how you approached me and how you approach new patients to see what's really going on with them?
It looks like art, but actually, I would say there is science behind it. And every time, like a new patient come to me, like you, at the first beginning, after hearing what symptoms you have, I will do a very traditional way to diagnose, to learn what channel is wrong and what problem is there. That's why in Chinese, in other words, in Chinese medicine, we have 4 different ways to learn the people's health. First, we observe patients, how they look like, what kind of the way you talk, you move, and we can see that's observe, right? And we call that we look. Second way is we hear your voice. It's and we hear how you speak, how you breathe, and the third one is we ask, how do you feel? What bother you? That's the mainly people we start communicate here to you tell me what bother you. And the fourth one is we take your pulse. And when we take your pulse, we take on both hands. And actually, my 3 fingers on your wrist, not when I take your pulse, I'm not just counting your heart rate. My 3 fingers can detect 3 different organs function. My 3 hands here, my 1, 2, 3 finger just feel your different organs function. In that way, we can tell which channel is too strong or too weak. And also after this, then we usually ask people to stick out their tongue. The tongue diagnosis is another very traditional way to learn what's your energy flow there, your blood circulation flow there, and how is your digestion, everything. That's we can gather the information to make our diagnosis. The purpose is to learn which channel is blocked, and are there any blood circulation problems, and if we find block, we try to find either the blood circulation is not good or the energy flow is blocked. We call that qi blocked, or some other pathogens like phlegm stacks there. So when we make our diagnosis, we have a certain principle way to treat it. Like in your condition, the first time you come for back pain, and after I hear your symptoms, I take your pulse, I learn that you have the qi stagnation, and it caused from your history, the qi stagnation caused by the improper use. And so then we start, then for you, the treatment is unblock the channel, unblock the energy, which is on your lower back. And by choosing the certain point, we can unblock the energy. In Chinese medicine, where there is a pain, there is a blockage. If from theory, ideally, if you have free qi movement, you are pain-free. So the good thing is, Mark, you come to us, you never wait too long. You come to us when the symptoms first emerged, like within 1 week, couple of weeks. At that time, the blockage is not that hard, so I can fix you in 3 treatments. But unfortunately, many people just wait too long, and they always think the pain will go away, pain will go away. Then after several years they come, then it will take more than 3 treatments. And so that's basically answer your question.
Which 3 organs are you feeling in the pulse?
Very good question, very good question. And on both sides, on different sides, they are different. Like on your right side, what I feel is when I do this, my index feels the lungs, and this is the digestive, and the third one is kidney. And on the other side is the heart, the liver, and the left kidney. So it's different. But from these 6 organs, we can learn a lot of your health condition.
So there's no prostate one up here to tell.
Oh, very good question. The prostate organ belongs to the kidney.
Okay.
So
and,
we can.
And did you feel something that told you that there's a problem there? You remember?
For you, your right kidney is pretty weak. So the treatment is focused on to enhance, make the right kidney stronger. That's why every treatment I use the heat on you. The magnetic heat I use, which penetrate very deep to warm up the certain area, then make the channels warmer. When the kidney is warm enough, the prostate, ideally, it will shrink a little bit.
You also asked me about dreams, whether I dreamed a lot.
Yes.
Were you picking up something, or were you checking for something?
No, actually, I specifically asked your sleep because I feel your sleep pulse is very weak. That indicates you have sleeping problem.
Partially because I'm getting up every 2 hours to go to the bathroom for my prostate.
Exactly, they are related.
Although I do have a very active dream state, and sometimes I'll write them down. They're not very stressful dreams usually. It is very active. And you also commented twice. You said you're under a lot of stress. So did you pick that up from my demeanor? Did you pick it up from my tongue? What?
Okay. Why I'm so certain to tell you you have stress, because I feel both on your pulse and the tongue, and your liver pulse. Usually, when people under stress, the liver pulse is very tight, and the tongue we can see as well. On both sides of the tongue is where the liver place is. You're always red. That means you're always thinking about something, overthinking. We are talking about.
So okay, we're now we move into the acupuncture part and the treatment, unless you've got something else. So you pretty much know what's going on from the diagnosis phase. Is there anything else before you put me on the table and start putting needles in me? Or we're ready to go to that?
I don't quite understand your question.
Is there something else that I'm really interested in the process? Is there something else that happens or that you do between the diagnosis phase that you just talked about and the time that it's time for me to get on the table for the needles?
Oh, of course. Without the diagnosis, I don't know what to do with you. And after I take pulse and check your tongue, I make my diagnosis. So I basically know which channel affected, and that to lead me to the treatment. So that's why I choose your face, your body position, and which channel, what point I need to work on.
Okay, so excuse me.
That's fine. Take your time.
So for the back and the neck, of course, I was lying on my stomach, and you put, do you refer to them as needles? How do you refer to them?
Actually, for the neck treatment, we are talking about arthritis this time, your neck pain involved. And so we work on the bladder channel, that's where on the both sides of the neck, and we choose certain points. Also, I add electric stimulator, try to push the energy flow. And when I open the channel, the treatment open the channel, let the blockage flow through, that's where your pain gone. So that's basically that way.
And you put needles in my head, I think some in my neck and back, and all the way down to my calf. So, and I think both sides.
Yes, that's another thing. You observe very, very well. And the reason is the needle from head to toe, instead of I only treat your neck, is because we always treat a patient as a whole. If you count, I usually put 5 needles on the head. That is for stress. And only when the person are totally relaxed, otherwise the needle won't work well. And that's why I always trying to relax you first. Then I put the needle on both sides of the neck. That's for the local treatment. After that, I put the needle on your leg. The needle on the leg on both sides is to trying to core your defense energy. When you're how to say that, when you have good energy to move through, it can unblock the energy on the neck. So the leg on the treatment is help to unblock the blockage on the neck. That's why the needle from head to toe.
And I've practiced meditation for a long time. And once I'm on that table and I have the heat on and you have music going and the room is dark, I relax 100%. I don't even experience my body. So
Right. That's the best.
It's very pleasant. I'm very curious about the placement of the needles. You would think that if they're not placed exactly right, then they're not going to do what they're supposed to do. But to be precise with different people, and even the same person a second and third time, how important is that exact spot, left and right and vertically, to make it work?
That's another good question. Basically, we have to choose the right point. We call that acupoint. We have 365 acupoint from head to toe, everybody. And we have to choose the word of acupoint in Chinese means where it's empty. That means where it's empty. That means where the needle cannot hit any nerve, cannot hit blood vessel. Excuse me. And we have to choose the right spot. The spot is empty where the energy flow can go through. That's the acupoint, the word of acupoint means. And you have to choose the right point to where to call the energy flow. Otherwise, you can try like your grandkids put needle on you. It's not only painful, it's not working. Right. So you have to be very precisely on the point. That's why we take 6 years training and a long time practice. And that's why many people tell me they have different experience from different acupuncturists, which I believe, because you need to be precisely on the spot.
So when you put the needle in, and it seems like you twist it a little bit, and there are different depths. Obviously, you don't put it as deeply in the skull, in the head.
Of course, yeah.
In the body.
You know, Mark, you are very good. And we call that needle, when you're talking about the twisting of the needle, there is a big field there we call the needle technique. We just we give the needle different signal. Actually, when you turn the needle, we have to turn the needle. When you turn the needle clockwise and clockwise, or you turn it faster or slow, it's all the different signal you gave to the points. So that is, like I said, a lot of technique there. And the different signal we gave to your body, then your brain accept a different signal to do the work, what we want to do.
So can you tell when you've placed a needle, do you have any indication that you've hit the right spot? You know, does the body react? So that you know, bingo, I've got it.
Yes. We call that got chi, G-O-T. QI, we got qi. You have to got qi. Otherwise, when we say got qi, we are talking about the needle contact with the energy flow. Otherwise, the needle you just insert the needle in the skin. It's not acupuncture. It's just, the needle just take decoration there. I call that decoration there because it didn't contact with the energy flow. The way when the qi comes, I know, the patients know, I know, you will feel something tightening. And what I feel is, it's like if you're fishing, it's when the fish grab your bite, you over the sudden you feel something heavy. And when you got qi, you cannot pull the needle out easily. You feel something grabbing it. If the needle didn't got qi, even the needle in you, it's so easy to take it out. We call that empty there. So there is some technique there.
So there were 2 points, actually both times recently, that one in my hand and one in my foot. And usually there are 2 of these points where, excuse me, I think I need a treatment. Coffee.
That's a too dry. You talk too much.
One right here for my coughing.
I know. You talk too much. You just said you just finished another meeting. Okay.
So there are usually 2 points, and they've been one in my hand and one in my foot, that when I picked up my hands or that foot, I could really tell there was some pain there. So, and I was meditating and I was staying very still, but I could tell if I just tried to pick it up, either of those up, it was very painful. So is that the energy? Is that what's happening there?
Okay. You are good again on this point. You know, the needles on your hand and your feet, we call that 4 gates. We have 2 hands and 2 feet. We call that 4 gates. This 4 gates is specific to release stress from patients. And you do have stress, so I hit the spot. That's what you feel. You said pain must be the very heavy, sore, kind of achy, right?
Yep.
That feeling is, we call that your gut qi. That's the needle is trying to unblock the blockage there, and that's why you feel the fighting, because you feel the sore.
Now, I have not been meditating recently. So I'm guessing that based on all the stress you pick up in me, that I really should go back to it on a regular basis.
Yes, it will be helpful, meditating.
So let's talk a little bit about the politics of acupuncture that's going on. We talked a little bit about this in the office, because after centuries of this being practiced, maybe thousands of years, practiced in China, finally in the last 20 years, it's being accepted in the US. And there are physical therapists that are doing it. I think there are massage therapists that are getting trained in it. A lot of people. And whenever I tell people that I've been getting this treatment, they refer to a term called dry needling. I think that's what the Americans call it. But insurance, and I think Medicare, let's talk a little bit about the politics of it. I think that they are now paying for physical therapists and others to provide this service, but someone who is trained in acupuncture from China, you're not paid through insurance and Medicare and that sort of thing. Talk a little bit about that. And you've actually worked in this area politically to try to move things along.
Yes, yes. Actually, acupuncture come to United States started in 1986. And for years, now we are talking about for 30 some years, all acupuncturists include Chinese and American acupuncturists. We work so hard to prove to our patients it's working. And finally, we, how to say that, we work on the state and the federal level to try to promote our profession. Actually, every year in Florida, in February, we go to Tallahassee. We have a IQ day, and we go there to show, to demo to the legislator how it works, what we are doing, trying to let them learn more about this and how safe and effective and also cost effective this technique is. We can help more people. But you know, like many professions in the United States, any newcomers is not well accepted easily. And but finally, like Mark just said, after 30 years effort, work hardly, and we finally, patients ask for this kind of treatment. It's natural, it's safe, it's cost effective. And Medicare started 2021. They started to cover acupuncture treatment for low back pain. But the funny part is they cover everybody else do acupuncture other than licensed acupuncturists. And yeah, you know, it's really, at the beginning I said, how it happens? Then I found acupuncturist as a new profession. We didn't have a code in labor department until 2020. No, until 2019. And but at that point, only labor department only add a code to our profession. Nobody add acupuncturists into Medicare, into CMS as a medical provider. And so that's why it costs this tricky policy right now. They cover everybody do acupuncture, even the nurse practitioner, but licensed acupuncturists do this. So actually here, thank Mark gave me this chance, this opportunity. I call every body, if you are interested in acupuncture treatment and you want to be covered by insurance, please talk to your local legislator. Let them know how awkward the situation is. And really, we want to, being a professional acupuncturist, we really want to join CMS because we want to help more people. We want more people to be accessible to this kind of treatment, natural treatment. So if patients can help us, we can help you.
Great. And sorry I was being so distracting. I've got this glow from my, this is where my blinds are coming in.
Oh,
It looks like a halo. Let me see if I can get out of it.
I see. We need to stop a couple of minutes. You want to adjust?
Let me just see if it seems to be following my face.
Yeah, now it's good. Yeah, the light play tricks.
There we go.
Yeah, now it's good. Yeah.
So they should contact their state legislators. What about on the federal level?
On the federal level, oh yeah, thank you for mentioning that. Actually, a federal representative from California, Judy Chu, right now, she bring up a bill trying to bring acupuncturists into CMS system. But she is, we are working on the co-signers on the federal level, and we are still working on that. If anybody, but I believe Judy Chu is Democrats Party. If we can find any Republican representative can co-sign, that'd be great. From what I know, we are still working on that. Right now, it's less than 20 people to co-sign, and we need more.
So if people will contact their state representative for the state level and
Yes.
their federal U.S. representative,
Yes.
that
Yes.
could be helpful. So what else would you like to communicate, either about the politics of it or about the art and science of it? It's such an ancient practice. More people need to know about it and the benefits, and as opposed to the cost. Look at what, and this is an irony. Maybe let me mention this a moment. So probably if I had gone into an outpatient clinic and gotten epidurals in my neck, they probably would have cost $1,000 a piece. I would have had to pay $10 a piece because of I have Medicare. I know my audience is shocked to know that I'm 65, but
I can
thank you. So it would have cost $30, cost me $30, whereas your treatments are a little south of $100 per treatment. But look at the real cost to the government in that case, and my belief about cortisone is it's a very temporary sort of thing.
It is.
So look at the economics of that. And then that also tells you why the medical profession is not that enthused about those who are focused more on making money than on providing care, that they would support the more expensive options than the least expensive and more effective long-term options.
I know. That's why. But unfortunately, sometimes the government didn't think the same way we think, right? And so lots of politics in this. What I want to talk about more about acupuncture is many people come to acupuncturists for their pain. They didn't know we can work on many internal medicine, like you just mentioned, enlarged prostate. And also, acupuncture works very well in stress management. And we can help people with sleeping problems. And also, in my clinic, we have lots of patients come for digestive problem. People have GERD disease, IBS, Crohn's disease, and so we can get good results from this natural treatment. Because like I said, we call your self-healing system to fix lots of problems. And I was MD in China, so I'm not any way to against Western medicine here. And I always tell patients, if you are really sick, you need medical care, traditional medical care you need. And but long way before that, we can do many things to prevent many sub-disease, sub-illness patients to be real patients. And that's the beauty about Chinese medicine, the natural medicine here. And that's why I choose this way to help people, because I really believe long way before we really ill, we can do many things to prevent it, to slow down the process, or even reverse it.
I would imagine that migraines, headaches would be
Oh yeah,
a really
yes,
good, acupuncture would be really good for that.
indication. Yes, we treat seasonal allergy and also the headaches you are talking about, different headache. I have people come to not only migraine is, I would say it's not hard to treat. I have patients who has cluster headache, which is very severe headache. And when the headache hit them, it's very hard to live. And acupuncture has very good results for the cluster headache. So
You know, I read recently that the general health of people during the pandemic has decreased, and then that people are not as active. Now here in Florida, we can be more active, but up north where the weather is cold, they're not able to be as active. And then that leads to depression. And there's a lot of that. I would imagine that you could help restore some of the balance in people and help with depression. Is that true?
it is. Many people's emotional problem is affected by the environment. And like you said, when the pandemic hit, we have lots of lockdowns. We couldn't live our normal life. We cannot travel. We cannot meet our friends and families. It's very easy to cause depression. And acupuncture by detox the liver and balance your energy really help you to handle the stress. And I always tell patients, I have a lot of patients come for depression. I always tell them, I cannot take the trouble from your life, but what we can change is your attitude. That's the key. And how we face the problem is the key. We handle it. Acupuncture can really help this.
You know, I'll mention Thrive for a moment, and then we'll start wrapping up. But I'm sure that, and we want to have our first Thrive location here in the Tampa Bay area, and we may need you to set up an office there, because I'm sure that people that are drawn to Thrive are about health, about having a healthy environment. So I think it will be a natural constituency, a natural group for you.
It will be, yes, it will be. I can see acupuncture, this kind of, and herbs, this natural healing art fit very well in your Thrive community.
So until then, and until you have your office at the first Thrive or a satellite office,
okay,
how can people best get in touch with you?
Oh, people can call us directly. We have office number, it's 727-384-4826. And I am located in St. Petersburg, Florida, which close to Tyrrell Mall area. It's very centered. And also, if you want to learn more about acupuncture, you can visit my website. And It's http://dr.aprilwang, WANG.com. So I believe Mark will attach behind and in at the end of this video, right?
Right. We'll put it in the show notes. So it's
Okay.
draprilwang.com. No,
Yeah. dr.aprilwang.com.
Okay. Or you can just Google her, April Wang in
Yes.
St. Pete. And
Yes.
I have a friend who's having headaches, and I mentioned you to him. And so here's an idea for people that are outside of the area. If she can bring results in a week, she's not paying me to say this. This is on my own. If she can bring results in a week, come to St. Pete Beach or Clearwater Beach and spend a week of vacation here and get 3 treatments and get your pain taken care of and spend some time on the beach. So how often can you do that? Do that much in a week? So
Mark, I have to say, being a doctor, I would say no guarantee treatment for 3 for 3 treatments.
Yeah, that's
no guarantee
true.
results. Yes, and like I said, your luckiness is you didn't wait too long to come to us. So when the problem is new, it takes less time.
Okay. Yeah, that's true. If they've got a chronic issue that's been going on a long time, you're not going to take care of it in a week.
Exactly.
I don't want to put too much pressure on you. There's that light following me again. Let's see. Well, this has been really a rich conversation. I want to thank you for being on the podcast, and maybe we can talk about some other topics that we might talk about and have you back on again.
Okay.
So thank you so much for your willingness to share your knowledge and experience, and I hope everybody enjoyed the podcast.
Oh, always, and I really want want to share my knowledge with your audience. Thank you.
Awesome. Awesome. And I'm sure you can find other resources connected to her website. So if you want to just dig into it, into the topic more. So thanks everybody for tuning in. This is Mark with the white nose. It's the opposite of Rudolph the Red-Nosed Reindeer with the white nose, signing off for this time, and we'll see you again next week. Thanks for joining us for another great episode of the Thrive Co-Living Communities YouTube podcast. To learn more about our mission and how you can support our vision of creating co-living communities worldwide, please visit us at thrivecolivingcommunities.org. To receive advanced viewings of our podcast and other exclusive content, find us on Patreon at patreon.com/Thrive Co-Living Communities. You can also learn more ways to support our mission in the show notes below. Amazon Smile, GoFundMe, Kroger, and our own Thrive Gear store, where you can buy t-shirts, hats, and many other items. Thanks again for tuning in, and we'll look forward to seeing you again soon.